Assalamu alaikum. Dr. Hussain Bashkolachi YouTube channel is with you. Today we will touch the international health and the situation in the Iran, Israel, and USA war. What is the public health situation there, as well as what are the global impact or the global public health or global health is term used for that because the medicine and health both are not understanding the political boundaries, and there are certain international rules and privileges of the doctors and the profession that in the war situation even they are under oath that they will not harm even to their enemies or to disclose any such thing which will harm the privacy and the beneficial harm, or there will be no malfeasance as per the International and World Medical Association guidelines. And the organization of the Medicine Sans Frontier means Doctors Without Borders. I hope they are also watching. And as the doctors are one of the cream of every nation, so their life security and their professional conduct is very important. So let us see that what is the latest situation and how we are moving forward to this situation. Let us share the presentation if that happens. With that, let I should see that the presentation is ready and it is shared. So right to the meeting. So this is the basic topic of the impact of the Iran-Israel-US conflict on the healthcare. Author myself, Dr. Hussein Bashkolachi, and I have used the artificial intelligence to make this presentation, and I think that's my first experience that I am using DeepSeek AI PowerPoint presentation. You will like it. There is no conflict of interest, or I am not on the side of any country, but being the Muslim, my biases can be exempted if you will find that I have. So these contents are from the AI generator, not myself. Uh, then coming to there are almost four content: background, impact on public health and global health, role of doctors and hospitals, and concluding thoughts. So let us see the background. You can see that the ongoing conflict involving Iran, Israel, and the United States intensified since late February 26. It is almost the fifth day that the war is going with full scale and escalating, and the latest technology, missiles, and other uh, projectiles are used to damage the warships as well as the nuclear installation. Even the hospitals, schools, they are under attack, and the humanitarian crisis is so has severely compromised regional and global health system through direct infrastructure damage and the collapse of essential medical services. So the infrastructure is under attack, and the supply of the essential medical services, including medicines and other important supplies, oxygen and other things are also important. Even the blood, which is required in emergency situation, and the normal healthcare system, particularly the cancer patients and other dire diseases, which can affect the life of the families and even the security and safety of the hospitals and doctors is at a dangerous point. So let us see what are the impacts. Uh, Air strikes have damaged critical facilities, include Tehran's Gandhi Hospital, leading to the destruction of a specialized department like IVF and the evacuation of vulnerable patients. So this is very important that the Gandhi Hospital in Tehran, but I think the present uh, statement of the Indian top leadership is opposing that kind of facility, and they are on the other side of the firing, which is coming towards the Iran, not going from the Iran to the Israel or the other US bases in other countries, Qatar, Bahrain, Oman, and UAE. Second is medical supply storage. US sanctions have previously reduced Iran medical imports by 70%. These embargo and other conditions were already in place, but after war they have been accelerated and the situation is becoming from worse to more dangerous. This has caused chronic shortage of cancer treatment, dialysis, uh, current blockades such as the Strait of Hormuz. This is the main supply of the energy, oil, and other supplies to Indian and Asian countries as well as towards the European countries. So, and it is in the control of the Iran. So the Gulf countries as well as the Asian countries, including the other countries which are connected with the Red Sea and Strait of Hormuz, lawyer further threatens global pharmaceutical supply chain. So the Hormuz Strait, which is a very short strait, but it is actually an international gateway to the trade and including the global pharmaceutical supply chain. Then we can see that emerging health crisis, including that I should go once again to the background impact. So emerging situation shows that if I can focus it. So the ongoing conflict involving Iran, Israel, and the US intensified since this I have already discussed. Let us move to the impact side. And overall medical shortage I have already discussed. And then coming to uh, the ongoing conflicts, yes, that we are discussing. So let us, yes, it is good. Overall health system, hospitals are forced to discharge stable patients prematurely, suspend routine surgeries, and halt cancer diagnosis to prioritize mass casualties. So you can see that the patients are discharged in a hurry without completing their treatment side. Then emerging health crisis. But before this overwhelmed system, hospitals are forced to discharge stable patients. Yes. Emerging health crisis, infectious diseases, breakdown in sanitation and water supply in overcrowded shelter increases risk to the cholera and hepatitis, mental health, traumatic exposure affects an estimated 30 to 50% of the population, means half of the population is under traumatic stress or in a mental condition, leading to widespread PTSD, post-traumatic syndrome, and acute stress. Vulnerable groups, disrupted nutrition and vaccination program have increased infant and maternal mortality. So, disrupted nutrition means to the children, milk and other essential nutritional items are not available. Vaccination programs are disrupted. So, the infant mortality and maternal mortality both are. So, let us see the other aspects if we can. So let us see the role of the doctors. Under international humanitarian law, medical facilities are protected as sanctuaries, means they cannot be attacked. That must not be targeted. The specific role includes role of doctors. Continuity of the care, this is one role, and emergency resource management is second. You can see in the picture also that how the hospitals can manage operation theaters, can manage. Uh, so let us see what is there. So the continuity of large Israel hospital have prepared to move operation entirely to. We are talking about the whole region where war is going. We are not only talking about the Iran, but we are talking from the humanitarian point of view. Operations entirely to protected underground facilities to maintain life-saving service during 2 to 4 weeks hostilities. So both sides and other Gulf countries, they are changing their sites, going underground, and you know that in that situation, a war surgery specialists are required, as well as the emergency care needs to be safe and resilient. Emerging resources, doctor must triage. Triage means select the according to the emergency only. So triage is a method of public health in which you screen and give priority which patient could be admitted, which could be dealt first, and the life can be. Protocols managing overwhelming volumes of wounded with limited staff due to military attacks. Uh, so, uh, this is the situation where we are then coming to the humanitarian monitoring organizations like World Health Organization, WHO use verified hospital data to advocate for ceasefire and mobilize emergency supplies. As per the WHO data and the other humanitarian organization in Iran, they have, because the casualties towards Iran are more as the even their top leadership and top political leadership as well as their uh, religious leadership both have been killed in this 4 day to 5 days continuing war. So they have mentioned at least 1,000 people, 5,000 people have been injured, and 1,000 people have been killed, including almost 200 children of age 5 to 10 years. Emergency resource management, we have first response, paramedics and medical personnel provide immediate field stabilization. often a high person risk. Recent strikes in Lebanon, something like that. So then coming to our conclusion, you can see that would you like more details on a specific medical supply shortage or international aid currently active in the region? So with this, I think you can see we are thanking and we have touched this important topic of impact of Iran-Israel-US war. So this is international public health. So some idea you will get that how in a difficult situation doctors can survive, provide continuing care, and be safe as well as make special arrangements when the attacks are there, wounded are there, so how triage can be applied. So the postgraduate people, MBBS, MPH, MSPH can be asked that how you will apply the triage in the war situation. So those who are in acute need, who can be saved, and particularly the people who are mothers, children, are more vulnerable, even the patients which are of the cancer and other dialysis situation, they will given more attention. And international law protects the hospital and doctors, and they must not be seen as the one side or other side. A neutral health care, a humanitarian health care is required. So thank you very much, Dr. Hossein Bashkolachi YouTube channel is giving you this latest situation because normal topics, diarrhea, communicable disease, non-communicable disease, but this is a international crisis and the uh, third world war can be starting started from this region. So about more than half a billion people are in the Gulf, and Iran is a neighboring country, and Pakistani doctors and the healthcare system, I think, should consider sending some of the supplies to the brother countries, not on the political consideration, but on the humanitarian consideration. And I hope the other countries will also follow so that the people anywhere who are wounded or in need of medical attention, medical care, they should receive without caste, creed, political affiliation, religious affiliation. That is medical profession. And our ethics also says that no harm, privacy, as well as confidentiality and universal health coverage is a right of everybody without any hardship, including medical or even the hardships of the war and other situations. Thank you very much. I think we are ending our meeting, and you will like Dr. Hussain Bashkolachi YouTube channel. We have crossed the borders from Pakistan to Iran, Israel, and USA, and we have sympathy with the doctors who are working in the war situation, as well as we wish that patient care, medical care, and the ethical and moral values in the war situation will also be maintained by the medical profession. Thank you very much.